Okay, I want to say a few more things about the connection between the brain and the gut, or otherwise called the gut-brain connection. I remember these kids, we had these twins, identical, absolutely identical twins. I mean, could not tell them apart. Maybe their mother could, but they both had sickle cell disease. And the interesting thing was, whenever one had a crisis, the other one immediately had a crisis. It's the craziest thing you could think of. When one had a crisis, the other one would have a crisis. And then, of course, everything they did was pretty much the same time. When they first came to my office, they had both lost their tooth in the same position, the same tooth in the same position. Everything was so similar. Well, I'm saying that to say that there's a similar relationship between the brain and the gut. What happens in the brain affects the gut. What happens in the gut affects the brain. You've heard of Cushing's ulcer before. That's like when I think there's an injury, it's some sort of trauma to the brain, results in an ulcer in the gut, usually in the stomach of the individual. So it's like almost a sympathetic response to what happens in the brain. And so it doesn't make sense. It doesn't make sense not to focus on the gut, whether your patient has dementia, whether your patient has a stroke, whether he has epilepsy, whether he has seizures, whether he has autism, whether he or she has autism, or even a genetic condition. We address a lot of kids with Down syndrome at the foundation, and over again, if all we do is just give them probiotics, we see a significant improvement because it has to do with how the gut functions, how the gut relates to the brain. If your gut isn't healthy, if your patient's gut isn't healthy, I pretty much guarantee you it's going to be affecting the brain. And I like to look at it this way. So, for instance, if you have two guts, and the gut of an average 5-year-old and the gut of a child with autism, if you're able to shrink yourself really small so you can get into that gut. Remember the movie, what was it again? Inner Space? Yeah, with Meg Ryan and Dennis Quaid. If you were to shrink and get into that gut without knowing anything about science, without knowing anything about medicine, you would know that upon going to the other gut, you would see that there's a clear difference. The gut of the child with autism, you probably see a lot of inflammation. You probably see, if you were to compare them with a lush green forest and um, wasteland, deserted wasteland. That's kind of like what the difference is. The kid with autism would be like the wasteland, a lot of damage. I know I'm being a little hyperbolic right now, but there's a lot of damage. I promise you. There's overgrowth of weeds and other bad uh, uh, vegetation, weeds and other things that you don't want in the gut of the child with the normal brain function. You will see that there's nice trees, forests, rivers. Everything is running smoothly. Lots of animals, lots of different kinds of vegetation, lots of different kinds of animals. But over here is very, very different. And I just use that as an analogy. So the key is to try as much as possible to make this gut approximate and approach this gut as much as possible, as close to this gut as much as possible. And we do that by various things. Probiotics, we give enzymes. Or before that, we try to flush out the all that junk really that has been accumulating there over the years. That we now replace. It's kind of like you're going to clear a field and begin to put the good seed in it, and then water the good seed, and then protect the good seed. It's something like that. I hope this serves you. If you want to know more about it, just contact us. All right. Take care. Bye.